It's me, Sophie. Here's my other question. What will your party do to support caregivers who are working hard to care for seniors and help us age at home?
Thank you, Sophie. The response will be from Benjamin, who will go first, and Benjamin's response will be read once again by Sue.
I will now read the response to question 2 from Benjamin Truong of the NDP. We understand the need to sufficiently support caregivers and workers so that in turn, they will be able to adequately care for both themselves and our seniors, especially in the context of Scarborough-Agincourt. The Ontario NDP has a plan to implement additional standardized training programs, as well as provide adequate funding and the resources for caregivers to sufficiently attend to the needs of our seniors. We also have a plan to introduce a caregivers benefit program, which would provide $400 per month to informal caregivers that do not qualify for existing federal tax credit programs.
Thank you, Sue. Now we move on to the second respondee, who will be Donny.
I will read the response from Donny Morgan of the Ontario Party. My party will look into the issues that our caregivers are facing, such as stress, isolation, financial burden, and we'll pass laws to provide better pay with more staff so that the workload can be shared. If we can provide help so that our seniors can age in the environment of their choice, we will fight to make it a reality.
Thank you. Now we move on live to Sue. Sue, would you please respond? Thank you.
So thank you very much for this very important question about the support for caregivers and care partners. Let me begin by sharing with SPLC the very exciting news from Ontario Liberal Party. We are committed to the Ontario Caregivers Tax Credit. This tax credit will be a refundable, tax-free, and pay out throughout the year. So if you're a caregiver, whether you're a daughter, sister-in-law, daughter-in-law, who are currently providing caregiving to your loved one, you will be eligible to be part of this tax credit rebate, okay? It will be rebate throughout the year, not at the end of the year, or this will also help seniors and the caregiver to get some support throughout the years by the provincial government. And this will also create a more access to programs and services to help caregiver who happen to be a family members. Because right now we have data to prove that a lot of family members are providing free caregiving services and not being recognized by the government. The other piece I want to share with you is that the Ontario Liberal Party is committed to paying caregivers, such as the personal support worker. First of all, the minimum wage will be $25 an hour, as well as we're committed to cancel Bill 124. I'm not sure all of the viewers who are watching today understand what Bill 124 is about. This is a bill, this is a piece of legislation that this provincial conservative government passed several years ago, capped this, the wages of all healthcare worker. So all the healthcare worker are capped at 1%. So preventing healthcare workers who are recognized by this government as heroes. So their salary is capped. We as the Ontario Liberal Party is prepared to cancel Bill 124 to make sure healthcare workers are recognized and respected, and most importantly, paid respectfully. We are also prepared to add additional wages for every person who are working on what they call short staff, because that's happening right now every day in all the healthcare setting. As well as we want to make sure we deliver fair, consistent pay for healthcare workers who are currently working at home or in the community and in the hospital. Right now, there's a disparity. I'm not sure the viewers watching today realize that the home care, community care visitors, as well as long-term care workers are not paying equally as those working in the hospital. So the Ontario Liberal Party is prepared to address this issue, making sure that within the healthcare sector, people who are working, whether you're a personal support worker in the community or working in the hospital or working in the nursing home, you should be paid almost at the same level. Right now, there's a disparity almost $10 to $15 per hour wages. This is not right when they're doing the same type of work. The other thing is that we are also prepared to support healthcare workers, such as caregivers, such as nurses, that if they're currently working and during the pandemic, we will be forgiving their student loans because we want to make sure frontline healthcare worker, whether they're personal support worker, they're nurses, RPM, registered practical nurses, that they are being supported by the government. That when they're working during the pandemic right now, we're in the 6th wave, they may have incurred some student loan while they're going to school to better themselves, to better provide care to us. We are going to forgive their student loan. And last but not least, we want to make sure all our healthcare workers are supported with mental health support. So they will have access to mental health services. This is very important conversation. I'm so pleased that you asked this question. Thank you.
Thank you, Sue. Thank you very much, Sue.
And responding to the next question will be Aris Babikian of the PC Party.
Ontario PCs will invest up to $1.5 billion more in home care and providing tax credit to make homes safer and more accessible. Our government is helping Ontario seniors and patients stay in the homes that they love. We are investing a historic $4.9 billion over 4 years to hire 27,000 new care staff, including PSW, nurses, and doctors.